This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to the highlight of your Sunday morning.
Sure.
It's another edition of Health Watch here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Dr. Molly is here and ready to talk to you at 855-839-1210. That's 855-839-1210 throughout the course of the show. If you have a question or a comment or anything you'd like to discuss with Dr. Molly, that's the number to call, 855-839-1210, 855-839-1210. Health Watch every Sunday here, 8 till 9 on Talk Radio 1210 WPHT. And another wonderful holiday that we celebrated.
Right, that's
Dr.
right,
Molly.
that's right.
And by the way, happy birthday.
Thank you.
Belatedly.
You too, John. Hey, we're Siamese twins like that, right?
Yeah. We're over 29.
Nah, that's it. That's it.
So tell us, what is it that is different about Innovative Medical? What actually do you do, and what makes you different?
Very, very good questions. So, as you know, we're a group of like-minded healthcare providers, and we work together to help patients and can do anything that you can have done in any other primary care setting. So if you need a prescription, we can write the prescription. We can get you covered. The docs can do what they have to do. If you need some forms filled out, we can do all that. But really, our focus is on improving your quality of life by actually helping you reduce the side effects from medication that's out there, the pharmaceuticals. And if we can do that with natural products and we deliver that by hydration, which is a better way to get to a therapeutic dose in order to do just that and reduce your need for these pharmaceuticals, then that's a win.
You know, we've talked about this many times. You get a prescription and they give you a book.
Yeah.
I mean, it's
true.
Literally a book.
It's true.
Of what it could do to you, which is negative.
Right.
And you say to yourself, well, why am I taking this?
Well, sometimes, I mean, this is the art of medicine when you think about it. Every doctor, when he writes a prescription, he has to look at risk versus reward. And unfortunately, with all the new designer drugs coming out, it seems like sometimes the reward isn't that great and the risk is higher than it has been. You know, and I think the bottom line is people should be really working at maintaining their own health and maintaining their own quality of life through these natural products. But unfortunately, even today, John, the natural products, including the vitamins and minerals, etc., you know, the quality may not be there. You might not be able to get a therapeutic value. So the way that we're able to do this, utilizing the hydration, is a better way and a better methodology in order to actually effectuate the change.
And, you know, more and more, you're getting drugs that are, how could we say this?
Complex.
Yes, and so it's just becoming harder to
manage
that.
And the other thing is, you and I both know, unfortunately, it used to be that your primary care guy was your GP. Remember when we used to call him the general practitioner?
Yeah.
Right?
Yeah.
Okay, now we call him his primary care. But the bottom line is, he used to be your advocate. So he knew all of the drugs you were taking, etc. Today, I feel like all of that's going out the window because I see the drug list that many of our patients come in, and I know that either they have failed to talk to their GP about what drugs they're on because of not only the side effects, but how the drugs may counteract each other. It's amazing to me.
All right, and we have a call already.
Wow.
I'll tell you, people have been waiting for us.
Okay.
We were off last week, so they've been waiting for us.
Okay.
Joanna in Runnymede, New Jersey. Joanna, good morning.
Hi, Joanna.
You're on Health Watch with Dr. Molly.
Good morning.
Hi.
Hi, Dr. Molly. I recently had a DEXA scan, and it showed osteoarthritis.
Osteoarthritis.
So I went to an endocrinologist, and she said on a scale of 1 to 5, it was between a 1 and 2.
Okay.
But she prescribed a drug called Fosamax.
Yeah, Fosamax, yeah.
When I looked at it, the side effects outweighed me taking this.
Yeah, I understand. That's a pretty harsh. Listen, Fosamax is one of the standards of care. It's prescribed often for people, but it is not without some problems. In particular, I guess you saw your GI problems, etc. Look. Bottom line is, what kind of vitamins and things are you taking now? Vitamins and minerals, etc. What are you doing for this right now?
I'm taking calcium, and I take vitamin D. I take turmeric.
How much? Good girl. Good.
And I joined the gym, and I've been lifting weights a couple times a week.
Good. It sounds like you're doing everything you can within reason right now. I would tell you, come in for the free consult. I'm going to give you a little more information. And we actually have a hydration protocol for you. And again, have you been feeling pain or no pain, nothing, no symptoms at all? Tell me what's going on. No?
No symptoms at all, except for my knee a few years ago.
Right.
I had arthritis in it, and I went to Rothman, and they gave me some cortisone shots.
Yes.
Since then, it's alleviated the pain in my knee.
Well, God bless you, and I'm glad of that. But there's a lot more we can do for you by using the hydration. And you're right to be on the calcium, very important. The D3, are you getting D3 with K2? Tell me what D3 you're taking and how much.
I'm taking it, hold on.
She's going over to the kitchen to get it. It's great.
I'm going over to the kitchen to get it.
You're a nice lady. Go ahead, dear.
I got it.
Okay. Now, is that a prescription item that she gave you, or just getting the D3 yourself?
I got, I'm taking vitamins A, D, and K.
Good.
1,000 of vitamin C, and the A, D, and K.
Okay. All right.
I think it's 1,000 too.
Good. All right. Good. So far you're doing what you can do. If you come in and see me, I can give you some information on what brand to get, which I think will help a lot. Okay? All right, honey?
Can you give me your phone number?
Sure.
It's
John will.
856 489 0505.
Okay, thanks.
Come in and see me, darling. Yeah. Very nice call.
You can call right now. Thanks for the call.
Thank you.
Isn't that a drug for osteoporosis?
Yes, it is. Yes.
My mother was on that.
Of course. I remember, John.
Yeah.
I remember. God bless your mother.
Yeah.
I remember, and I think she did have a few side effects from that.
She did, yeah.
And it isn't an easy drug. But there are some other things we can do. But osteoporosis, osteoarthritis, they're terrible conditions. And, people got to get on it, women in particular. There's a neuroendocrine relationship. When the hormones have changed in our menopause years, we run the risk of fractures, etc. So it's nothing to joke about. You got to get in to see your doc. And if you need a medication, you need a medication.
Back to what we were talking about.
Sure.
The hydration and et cetera.
Sure.
You treat most things with hydration.
We do, because it's a better way to deliver the natural products. Because it's a direct hit. We're able to reach a therapeutic level for the individual patient. And again, this is not spa. You don't come in and say, hey, I need my bone drip today. No, it doesn't work like that. You actually are getting an order for a particular challenge you may be having if you have a problem. Although we do a fair amount of well care, you know that. But in this case, we're going to put together a particular IV protocol for your particular problem based on the information that you've imparted to us and based on what the docs think you need.
Now, hydration, we say that's the generic term.
Yeah.
But your protocols
are not generic. Yes.
Are the key to this,
right,
because you have over 600 of them.
Right. They're variations. Listen, protocols have been around for years. Everybody knows. I hear so many people come, oh, your patient needs a Myers cocktail. I laugh. I say, okay, thank you for telling me that you need a Myers cocktail. Bottom line is Myers cocktail's been around since the 50s. It's named after a particular physician. That was his cocktail. If you don't think there's been more scientific improvement in natural medicine since the time he developed that cocktail, wake up, smell the coffee.
And so how many treatments would you, to see a change? I
think we can see an effectuation of change, John, in as little as 5, and again, as much as 40 treatments, depending on how severe the situation is. You know that yourself. Listen, you and I talk about being lifers, right?
Yeah.
Okay, and we are. We are lifers, and that's unfortunately with the multiple history that we have, meaning we don't have one comorbidity, we have several.
Yes.
So guess what? You got to take care of yourself. You have multiple metabolic issues, so that takes a little longer.
We are coming up on our first break of the morning. This program is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. 855-839-1210 is the number here in the studio. 855-839-1210. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And I'm your host, John DeMasi. Dr. Molly and I both return after these words. We had a caller who asked us before what the number is at Innovative Medical Associates. This is a good time for us to tell you. 856-489-0505. 856-489-0505. Operators are standing by right now at Innovative Medical Associates, and they'll be happy to take your call. And really, what you want to do when you call, you get more information. But most importantly, if you want to sit down with Dr. Molly and go over your situation, book that initial consultation. It is complimentary. It doesn't cost you anything. So you sit down with her and you can really find out a lot about your situation. 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates. And again, our number here in the studio, 855-839-1210. You're going to talk about one of your favorite diseases.
If there is such a thing, John, as a favorite condition,
yes.
It would be good health. But
yes.
Nonetheless, I'm going to talk about Lyme disease. And one of my colleagues made a joke. They said, your patients keep referring to it as Lyme's disease, and it's really Lyme disease.
Yes.
I said, yeah, okay. I said, if it was Lyme's with an S, it would probably be scurvy, right? Because they're not getting enough vitamin C.
Right,
but
right.
Lyme is what we're talking about. So Lyme disease is a very interesting thing. I have a 24-year-old or 25-year-old new patient who came to see me for a free consult. And it turns out that he had an exposure to Lyme. He definitely had the tick bite. He had all of the signs of the tick bite, John, like the bullseye and the butterfly rash, etc. So he was treated with traditionally IV antibiotics. He was treated with some other antibiotics that were oral, and his doctor told him he was completely cured. And technically, he was cured of the Lyme tick disease. However, if you see this young man, he must have lost, he said, 15 to 20 pounds. He looks like he is just so fatigued. He has real challenges, not with pain in the joints. I mean, he is a perfect storm of all the post-Lyme syndrome symptoms.
Wow.
He's
really,
right.
And he's a young guy.
He's a young guy. He's an entrepreneur with his dad. They own some retail. And I've got to tell you, I started thinking about his case. He started with me for the first time this past week. He came in for one treatment. And we have to look at that complex pathology of tick-borne illnesses. Do you know that it takes, right now, the increase in Lyme in our area, which mean like the Philadelphia, New Jersey, Delaware area, is something like 200-fold from where it was in 2019.
Wow.
It's because, you know what it's telling me? It's telling me that the way the weather, et cetera, everything, and the strength of the tick population, the genetics of the tick is what I'm talking about, how it has evolved. So we really have to pull back the layers and help him restore some basic health to him.
We're going to pick that up in a moment, but first we have Frank in the Northeast.
Oh, Frank. Hey, Frank.
Frank, good morning. You're on
Hey,
with Dr.
Frank.
Molly.
How are you?
Belated Happy Easter.
Thank
but
you.
Dr. Molly, put your fine wine glasses between two soft pillows. Here I go. Happy birthday to you.
Oh, no, Frank.
Happy birthday
Thank
to
you.
you. Happy birthday, the best, the greatest, Dr. Molly. Happy birthday to you. Happy birthday, Dr. Molly.
Thank you, Frank. And, you know, you sound so much better. I'm so thrilled to hear you and to hear that you're doing a little better because, believe me, you're one of those complex cases that keeps me up nights thinking about you. And
Well, Dr.
God
Molly,
bless you.
Well, I've been sounding awful because on allergies, like chronic bronchitis, it makes me feel I'm real tight and everything.
Yeah.
Yesterday was really good. Today's okay. But let me ask you, and this is the king of stupid questions. Are you ready?
No. Yes.
Can I call your office later? Can you give me, if you know, a neurologist?
Yes. Yes, I do. And yes, I would happily give you that referral. Absolutely.
Okay.
And I think you'll like that. You know, it's very hard to get a good neurologist. You know that. One of my physicians has a great one because she herself has a neurological disorder. So please, yes, call the office and we'll happily give you the name.
Thanks again, Dr. Molly. You are the best.
Bless.
And it was John's birthday recently, too?
Yes. He just had it, too.
Happy birthday to you. Happy birthday, Mr. John DeMasi. Happy birthday to you.
Hey,
we all feel that way.
Frank, you're not going to believe it. You're not going to believe this.
Yes.
American Idol just called us.
No, I'm not going to believe you.
I think you'll win. That's
Dr.
great.
Molly, let me say something funny. I went to Catholic school. I did not want to be in choir. You were told you were in choir. They picked boys out, and when you report to practice. I knew I couldn't sing. I lip-sang for 3 days. Then she finally had an audition when the rest of the people left, and she goes, Master Ramos, choir's not for you. I got thrown out.
Right,
thanks, good Frank. God bless.
Thanks for the call. We appreciate it.
God bless.
So, back to this situation of Lyme disease.
Yeah, so we know that the first line therapy, of course, is the antibiotic. That's right immediately after they really see that the infection has occurred. And you've tested positive for the Lyme titer, that kind of thing. But many people who really contract Lyme don't realize it until months, and sometimes even later with the chronic symptoms that they have as the body reacts to the biotoxins produced by the infection. So here's the things that can overlap with so many other types of conditions. They've been treated for fibromyalgia, chronic fatigue, and many times they've been told they may have cancer. I mean, it's just an incredible situation. So what we do is we look at this post-Lyme disease syndrome, and it is devastating. You can have aches, flu-like symptoms, severe pain, muscle stiffness, extreme fatigue, rash and skin problems, allergic reactions, and as Frank was talking about, neurodegenerative diseases, brain fog, depression, digestive, cardiovascular diseases. That's often overlooked. And of course, there's many more. So the chronic stages, the using IV antibiotics definitely won't work. But we have to realize there are co-infections that are burrowing into the tissues. So therefore, and it goes past the blood-brain barrier, which means it can actually give us these neurodegenerative disease-like symptoms. And so what we have to do is, what do we have to do? We have to look at anti-inflammatory hydration treatment protocols.
What is Morganelli's?
Oh, there you go. This is a great question. Morganellas, this young man presents with Morganellas disease. And if traditional physicians do not believe in Morganellas, it is pustulars or spots on the skin, and the skin can release what looks like cotton fibers coming out. Now, I got to tell you, in 27 years in our type of facility, we've seen this twice, and we helped the patient improve twice with this. Now, they believe this is a pseudo disease, meaning it's in the person's head, right?
Oh, boy.
Do you know how many times I've heard this? You know how many conditions I've heard that are in the person's head? So traditional physicians do not believe that this is a true condition or state, because you test negative for the viruses, you test negative for the bacteria, you test negative for parasites. So they believe it's a pseudo or a psychiatric type problem like depression, etc. So they want to treat it with conventional types of treatment that you usually do for people that have compulsive disorders, right? But I got to tell you, I looked at this. I've seen this thing. I don't know, but I know one thing. I had a great professor who said to me, "Hey, Dr. Molly, you're getting your PhD this week?" I said, "Yeah." He said, "Just remember this," he said, "even crazy people get sick." Get that, folks? So don't let people tell you something's in your head. It may be in our head because you may be sick. It may be there.
You know how many times I've heard that from your patients who said, well, they told me it was in my head.
Yeah.
And then I came to Dr. Molly, and it wasn't in my head. So,
well, we were treating it, and we were able to restore their quality of life. And when I say treat, I'm not saying we eradicated a particular parasite or something like that. I'm saying we improved someone's immune system. We got them back to quality of life. The thing about this Lyme that is so really, it is a terrible condition, and it's post-Lyme condition, is because it's affected by other things, and you then present worse. For example, if you have a mold exposure, or you have a mercury exposure, now you have toxic metals or heavy metal damage. Guess what? It impairs the detox pathways, so now I've got to look at extracting or chelating out the heavy metals too. So in other words, this is a multifaceted approach that we use in our clinic for Lyme.
It sounds very complicated.
It is complex, so it may take this young man at least 30 treatments. I would say he's going to start to feel better after 10, but that's not good enough, because I don't think we can reverse all the symptomatology and everything that is being challenged in his metabolics until we go on through the detox and then also rebuilding his immune system.
We are coming up on the halfway point of the show, which means we still have plenty of time to take your calls at 855-839-1210. The show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Again, the number here in the studio, 855-839-1210. We always tell you call early so you can be sure that we can get your call in. And no exception right now. Give us a call, 855-839-1210. With Dr. Molly, I'm your host, John DeMasi. We both come back with more Health Watch after these words. We are back here on Health Watch. 856-489-0505 is the number. That is for Innovative Medical Associates, located in Marlton, New Jersey. And operators are standing by right now. They'll be happy to take your call. And really, do it now, because it's on your mind and you're saying, yeah, I should call, but I'll call tomorrow. You know how it is. Procrastination 101.
Right.
Call right now, 856-489-0505. That's the number for Innovative Medical Associates, again, located in Marlton, New Jersey. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com, and you'll find a lot of good information on that as well. So check that out, innovativemedicalassociates.com. It's Health Watch here every Sunday, 8 till 9, Talk Radio 1210, WPHT. Our number here in the studio, 855-839-1210. That's 855-839-1210. We're going to get back to what we were talking about before. Detoxing?
Yeah, detoxing, John, in particular in terms of for Lyme, but also for environmental medicine, obviously talking about the heavy metals in the prior segment. So one of the things, and this actually has a lot of clinical studies to show you that we use in this particular process. We remove the heavy metals with chelators like EDTA. You know that. It was used in my cardiac for a long time. But we can use this for lead, mercury, arsenic without removing the essential minerals that the body needs to continue to operate. But I have to say that in addition, I use, and you've heard me do this, subclinical doses of traditional meds. You know that. Well, believe it or not, there is an old cholesterol powder. Are you listening to me? That's how old this is. An old cholesterol powder that the compounding pharmacist used many moons ago, I think in the 50s, John, if I'm not mistaken, for cholesterol support to make sure that we could reduce cholesterol. And believe it or not, it didn't have that many side effects as it does with some of these new designer injectable drugs, okay? But it does have a side effect. But we're talking about a subclinical dose. And we use this. As a result, it works sort of like fiber or pectin, so that it will then, as we are doing the chelation, the chelators, getting out the metals in the digestive tract, it will soak this up and then you excrete it out through the bowel. This is a good way to get rid of heavy metals without putting somebody through a terrible detox. So that's one of the things that we use, not only with Lyme, but even in environmental medicine, particularly mold. So the other thing we have to do is we have to really look at supporting phase 1 and phase 2 of liver detox. And I have to tell you that is very, very important. For this, we use things like milk thistle extract, some dandelion, ginkgo, that's something we use, NAC, alpha lipoic acid, MSM. There are so many things that we derive from, and we also use beta-glucan. So these are some of the anti-inflammatory properties that we use, things that we use, as well as using this to support the liver function, which, by the way, is also damaged not only with Lyme, but with environmental toxins.
Should we be concerned? Should we follow the air quality report?
Oh, my God. Listen, we could go crazy doing that, but the point is, what should be happening, I think, is we should be looking at running traditional laboratory tests that really look for heavy metals. Okay. And it's interesting. I had a patient who came to see me a few weeks ago, a woman, very successful, folks. She had high levels of arsenic. How did she get that? I don't know. I've heard that there's arsenic in, of course, rice. We talked about that. Yeah. We talked about it in almonds. She leads a very healthy lifestyle. I was kidding her and said, I'm sure nobody's trying to poison you. It just is there. So the point is, what we need to do is get that out in a gentle way. And then we have to really look at restoring her liver function to an optimal amount with the glutathione, phosphatidylcholine. It's called a lipid exchange, which means it's very important for dislodging the excreting the toxins. Vitamin C is used. You know that. Artemisinin is used. There are so many things, and I would tell people, look at the traditional studies out there, not just for Lyme disease, but for what's going on in environmental medicine today, which I do believe has a role in the Lyme continuum.
Should we be concerned, though, about the air quality?
I think we should be concerned about all of it, John. Yeah, I mean, we talk about our water quality, right? A few weeks ago, we heard I live in Philly, right? I'm a Philly girl. And they said, our water was no good. Then it was good. Well, I'm a scientist. I sort of felt, geez, I don't know about this.
Yeah, from
good to good. I think it went from good to worse. Yeah. So, I was off tap water. But the thing is, Look, we bathe in our water. We're using our water for our pets. We bathe in our water. You can't get away from this. So what do I believe in? I believe in doing courses of chelation, preventative. I believe in maintaining our own immune system through hydration therapies. And you know exactly what I do for my post-cancer patients, right? If we don't have a good immune system, anything can affect us.
All right, 855-839-1210 again is our number here in the studio. Dr. Molly is ready to talk to you at 855-839-1210. It's just very interesting. It seems like this is everywhere.
Yes.
And there's really, what can we do about it?
Well, here's the thing. As I said to this young man's mother, we can't put this guy in a bubble, can we?
No.
He can't live in a bubble. So the point is we have to work very hard to strengthen his immune system, fight infectious agents, remove the toxic compounds, support the body's detox pathways, and modulate the inflammatory response. So really, that's the crux of what we do for all kinds of autoimmune disorders as well. When you think about it, it's following somewhat the same pathways. We need to do all these things, and we need to do this in a strategic manner, John. You can't just throw stuff at the wall and say, okay, we're going to give him this IV today. No, there's an actual thought process to how this is done. And I can tell you, we've had some really, really good results as a result of doing it our way.
I can hear you now say inflammation.
Right. What is
inflammation?
Right. What do we need? What is our problem? Who's the devil? If it isn't just right, John, it doesn't make sense. It's Goldilocks theory again. We need some inflammation, not too much, not too little. And we can't have it overshadowed by certain types of challenges that are out there every day. Look, we have to live, John. We have to live.
Going to give us some updates on some of the patients?
Sure. Let's start with Sandy. Everyone knows Sandy, and it goes into our first caller. And she has severe osteoarthritis. You know that. Now, what was interesting is she did not ever want to do the Fosamax thing. So we actually put her on a particular protocol that included an injectable drug. It really did. And she did pretty well on that in terms of strengthening her bones. But she has the genetics that really support this osteoarthritis. So what has happened is this past week, now she's very faithful about coming in. But you've seen her. She has trouble walking. She has trouble with her arm. It's just unconscionable how this poor woman is. But, I started thinking about this. She was a school teacher for 30 years in an old building, too. And I'm wondering if part of this wasn't related to the toxic exposures as well. But nonetheless, she now has the problem. So this past week, we did a little regenerative medicine for her. In fact, looking at some smaller proteins using amino acids and possibly the peptide kinds of things. And it did seem to help. She called me the next day and said, "Oh, Molly, I got a really good night's sleep." Now, I wish I could say she can run the marathon. It can't be done.
No.
If we can give her intermittent relief, I feel that's a win for the clinic and for her.
She's also getting physical therapy, too,
right, which is very important. And you know that as well as I do. Look, the bottom line is one type of therapy is not the answer. You want to look at the patient as a whole. Holism means looking at the patient in his or her entirety. And that's something we really look at. We know that you just can't say, throw out your medications, just do nothing but natural, or only do natural and then don't worry about your medications. That isn't our approach. Our approach is we're going to use everything we need, and we want to keep you as safe as possible.
And that's the bottom line.
That's it. And we want to improve your quality of life. Can we cure? No. We can't cure some of these conditions, particularly these autoimmune conditions that are seeing and this excessive inflammation. But can we help you hold it down? I would say yes. And I'm going to tell you something, John. I think you're the living embodiment of that. Because if you think that just a few months ago, and it really is, that you had that terrible situation, And I believe that was caused by inflammation because of blood sugar, etc.
Yes.
And look at you now.
Yeah.
Okay? Look at you now.
There's definitely a correlation between the two, yes.
Big time. And so that works.
Okay, we are coming up on our final break of the morning, which means you still have time to jump in here with a question or a comment for Dr. Molly Fantasia. 855-839-1210 is the number. 855-839-1210. It's Health Watch Sunday mornings, 8 till 9 here on Talk Radio 1210 WPHT with Dr. Molly Fantasia. I'm your host, John DeMasi. We both return. More Health Watch after these words. We are back here on Health Watch. Operators standing by right now at Innovative Medical Associates. 856-489-0505. That's the number. You can call them now. You can call after 9 o'clock. You can call tomorrow. But most importantly, call 856-489-0505 is the number. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And don't forget, if you missed any of today's show or if you just want to hear it again, we are on this afternoon. It's our Health Watch replay. We call it the Sleeper Special. A lot of people tell us, I sleep. Okay, 4 until 5 this afternoon. It's our Health Watch replay here on Talk Radio 1210 WPHT. But this is the live version, Health Watch here Sunday morning, 8 till 9, Talk Radio 1210 WPHT. And again, the number here in the studio, 855-839-1210. 855-839-1210. We have an update on breast cancer patients?
Yeah, we have two in particular. I have a very young woman who has an 8-year-old son, Dominique, and she actually comes all the way in from the Poconos up near New York.
Wow.
Can you imagine?
Yeah.
Comes to me. She was referred to me by my consulting oncologist, and I'm glad she's there. She has a very interesting case. She's doing exceedingly well. She's on her second set of 10 treatments. In other words, her particular protocol calls for 30 treatments, and so she already had 10 weeks into the clinic. Interestingly enough, she was up to see the oncologist. He said she's doing exceedingly well. I got the report, and he said, this is interesting, Dr. Molly. Her lesions have not spread. There are no new lesions. Several of her lesions have reduced in size. The other ones are stable. He said, I attribute a lot of that to what you are helping us do. And I thought that was a great endorsement from him.
That was what I was going to ask you. What are you doing?
Well, we're using vitamin C. I'm using a particular protocol that we use for cancer, including some other homeopathics that are very unique for breast cancer. And again, I'm using a subclinical dose of a particular pharmaceutical for the patient as well. And she's doing really well. My young woman, I have another young woman, as I told you about weeks ago, who I told you was born with hydrocephalus. Do you remember that?
Yes.
She also is a cancer patient, also seeing the referring oncologist who referred her back to me. She's doing great. Her tumor markers have shrunk by less than 50%. So in other words, her tumor marker, more than 50% than when she started with me. And again, the good doctor wrote to me, texted me and said, listen, we're doing everything right. We are doing everything right. He said, I attribute a lot of this to what you're doing because she was able to tolerate so much better the chemo.
You know, that's interesting because I'm curious as to what exactly it is. And you can't tell us everything.
No. But vitamin C is in there. But it's how you use the vitamin C. In this case, I'm using it as a pro-oxidant. Vitamin C is a unique compound because it can either be an antioxidant, which is what most people are familiar with, or a pro-oxidant. How does it become a pro-oxidant? Well, the synergy of some other things can help it become a pro-oxidant. Dosing can help it become a pro-oxidant. So there's a little secretness to the protocol, but I would say it's proprietary in nature, but it is used in the treatment plan. But she's doing well because she's tolerating the traditional treatment. So it goes back to the philosophy of the clinic, John. It's not one thing that helps the patient, but it can be a myriad of things, but using them all correctly.
But she's tolerating the chemo
Correct.
Because of what you're doing.
That's what the good doctor sent me. He said, I never thought she'd be able to take the chemo that she needed because she was at a very advanced stage. He said, but I can't believe it, and she's doing well. And he said, you have a lot to do with this, Dr. Molly.
And there's a lot of stories like that. I mean,
many stories like
that. I mean, you could write several volumes.
I think so. But I got to tell you, John, again, it's proper use of conventional medicine and integrative medicine or functional medicine, the way we do it. The other thing is, I think surveillance. I have patients who are very worried about their surveillance, meaning you have cancer, you should be surveilled. Well, there are many ways to do that. The fact that I see a patient pretty often, meaning at least once or twice a month, has been very helpful in surveillance after someone has completed a course of treatment, assuming they don't have a lot of comorbidities like we do. In other words, when you have comorbidities, you need to be seen more often because the comorbidities get out of hand and then interfere with your cancer protocols.
Yes.
And there's the problem. Most people don't come to me with just one straight line problem. It's very complex.
When you talked about surveillance, how often realistically should you be surveyed?
I think once you have cancer, I feel like you should be surveyed for the rest of your life every few months, period. I mean, I'm a survivor, so I'm a big believer that we hold the key to our own good health. I believe that. I really do, John.
It's been 30 years.
Yeah, 1994.
Wow.
I had a diagnosis. Boy. I got another bout later, which is later, but the first one was 30 years ago in January of 94.
And you're going to be around for a long time.
Well, I don't know about that. That's in the good Lord's hands, okay? That is the good Lord telling us what to do, John.
Any other updates on patients?
I think yes, I have another gentleman who came to me with prostate cancer, and he was stage 4. He decided not to do all the conventional treatment. He had some surgery. He was referred to me from another physician who said he an integrative physician, by the way, who said he couldn't give him the vitamin C, the protocol the way I was giving it. I had shared a little bit with the patient, and he said, go back to Dr. Molly, get a treatment a couple times a week there, and you are more than welcome to come back to him. So this is a spirit of cooperation I like to work in. Yeah.
And
he's doing great. His PSA is 0.1, and it's been at 0.1, and
that is good.
That is good. Really is good. And when he started, he said it was up about 0.4. And I think the idea about surveillance in this regard is if you have your prostate out and you start to see that number go up, even if it's within normal range, you ought to be in my chair. Because even if it's going up in normal range, your prostate's out. You shouldn't be making a prosthetic antigen, right? The protein, right? So I worry about that.
We often talk about, most of the time, we talk about patients that you've helped and et cetera, variety of conditions. But what about preventive maintenance?
Man, if I could tell everybody, if people would get in early, like I think an ideal time to start medical hydration is probably in your late 30s. That's an ideal time because you're not over the hill yet, guys, so you're not really feeling it, But as we start to approach 40, you start to have some challenges. 50, you start to have some challenges. 60, you have a little more. And as my good friend and first medical director always told me, after 75, all bets are off.
That's right.
So, I think it's good to maintain your quality of life from early on because this is the joy of life. Your quality is the joy of life. If you can't do the things you love, there's no point in living.
We only have one go around, so
that's what we hear. I mean, until we're in the arms of the Lord, which I know happens, and I know it's wonderful. But if you want to maintain your quality of life in this plane, I believe medical hydration, not hydration that's cookie cutter, but somebody who really sits down with you, hears all of your goals, knows your your vision for your health. That's important too.
And there's a difference between medical hydration.
Absolutely.
And the spas.
You better believe it. There's a huge difference. There's a huge difference in the types of my nutraceuticals, the extractions. As you know, I'm very particular about the powders. I want as much as we can use from God's ingredients because I believe in them. I know that the body has an innate ability to discern the difference between processed stuff, including the foods that we eat, and natural. And the more natural we can be, the better it is. Now, John, you know I'm not the food police, but I do believe that there are some things we really have to do to maintain our health as we get a little older. It's just the way it is.
What can people do besides the hydration?
I would say I'm big on utilizing, if you've had a previous bout of cancer, I'm very big on utilizing fasting, intermittent fasting, not fasting to be detrimental to your health, but using it with someone who knows how to do it. I believe that if we should eat a little cleaner, limit the amount of alcohol we think. But again, I'm not going to make you into some kind of guru. I'm looking to just maintain a good quality of life so you can enjoy your grandkids and, enjoy the activities you like, and look at regenerative medicine to the future, which we do a lot of. You know that, John. We're doing a lot of PRP, etc. So there are many ways to help improve your quality of life.
And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now at Innovative Medical Associates. 856-489-0505. 856-489-0505 is the number. And, of course, the website, innovativemedicalassociates.com, innovativemedicalassociates.com. Check that out as well. A lot of good information on that. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, Lana, and Catherine, and Donna, those are our nursing staff. We have Joanne, we have fabulous Fran, delightful Dee, and our nursing assistants, Karen, Kathy, and Sandra. I'm your host, John DeMasi. Thanks for listening. Have yourself a great week, and we'll talk to you next Sunday, 8 o'clock, right here, Health Watch on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.